It's a little bit after 7 o'clock, so thank you for coming. I appreciate you all being here. And my name is Ron Gleason. I am the new CEO at Mineral Community Hospital, and wanted to spend some time talking to you about what's going on at the hospital, some of the issues we're facing, and a levy that was placed on the ballot for the upcoming election, and answer any questions that you might have about that. First, I want to spend some time talking a little bit about why we are doing what we are doing, and then after I've had a chance to talk for a little bit, we can just open the floor and try and answer any questions that you all might have. Mineral County is at great risk of losing its hospital. And I was hired a few months back to come here and try and help keep that from happening. The first thing I want to say is I apologize that I have to be standing here in front of you tonight. I would rather not be. I would rather that the hospital was in good financial condition, and that we could take the hospital and go forward from here and make it an ongoing operation. But as I stand here before you, I can't do that. We've got some very serious problems at the facility. If I could go back and remake some of the decisions that got us to this point, I would do that, but I can't go back in time, so I can't remake some of those decisions. A couple of the meetings I've been to, and I think last week I went to 8 meetings in 3 days. And a couple of those meetings turned into a lot of people wanting to do this. And I try to live by the rule that blaming somebody else for what happened has never solved a problem in the history of the world. So at this point, I think what we need to do is go forward from here, play the hand that I am dealt, and try and make it so this hospital can survive for many, many years to come. What we are proposing is a 2-year levy. It was approved by the county commissioners a few weeks back to go on the ballot. The levy would be for 2 years in the amount of $498,000 for each of those 2 years. That converts into, for a $100,000 house, that's $64.09 a year, $5.34 a month, 17 cents a day. For a $200,000 house, it's $128.18 a year, and $10.28 a month. And what I contend is that one trip to Missoula, and a lot of us would pay for that trip. Again, it is only for 2 years. The next thing I want to talk about is what losing the hospital would mean to this county. Right now, the hospital, we see about between 12 and 1,300 emergency room patients every year. A lot of those patients come to us in very, very difficult condition. If we were not here, there are a lot of people who come to us with, for instance, stroke, who would not receive the clot-busting drugs, the stroke drugs that we have at the facility, and would therefore either not survive or be disabled by the time they made it to the next stop. The clot-busting drugs, there's an old adage that time is brain when you're talking about stroke. And matters of minutes can make a lot of difference when you're not getting those drugs. The same thing happens with heart attacks. We see a lot of coronary issues and a lot of stroke. We also see a lot of trauma victims, and we fly a lot of people out to Missoula, but the stabilization part of that is extremely important for these patients when they come into our facility. So having the emergency room in Superior is really important for people who come in off of the freeway, and we get a lot of freeway accidents. One of the things that is really important is the impact of not having the hospital on our emergency medical services in general. We have a very difficult time in the state of Montana recruiting emergency medical services people. And a lot of the people that we do have in EMS have the same color hair as I do. They're getting older, and they're starting to retire out of the emergency medical services. It's very difficult to recruit younger people into EMS. We try, and we have a few in our local EMS, but not a lot of them. If we were to add an hour each way for those EMS folks, it makes it less and less likely that people would sign up for those EMS jobs and help us out and help this community out. So that's from the patient side, and that's obviously the most important piece of this, is what it does to the patients in the county if we lose this hospital. The second part I want to talk about is economics. Last year the hospital paid out $3.9 million worth of salaries and benefits. Through January of this year, we paid out about $2.15 million worth of, now we work on a fiscal year end, July 1st to June 30. So far the first 7 months of this year, we paid out about $2.1 million of salaries and benefits. The business community really counts on that money. Without that money in the community, a lot of the businesses are going to be hit very, very hard in this community. So, and throughout the county. If the hospital were to close, many of you know that Mineral County is, along with Sanders County, are two of the highest unemployment counties in the state of Montana. If the hospital were to close, we employ about a little over 90 people in total. That converts into about 71 full-time equivalent employees. Those 90 people would very unlikely be able to find a job in Mineral County. So they would have to do something else in order to find those jobs, and many of them would have to leave the county, especially since a lot of them are trained to provide healthcare services, and that's their vocation. So if they were to leave Mineral County, it will have a very big impact on real estate prices. The value of real estate will decline. And if there's no hospital here, I was just talking to this young lady over here and hearing her say that one of the reasons that she moved into Mineral County is because there was a hospital here. And there are a lot of people who make that decision. John, our board chair, one of the things they looked at before they moved here was, is there a hospital to provide care? So not only will we be losing some people in this community, we won't be replacing those people moving into the county to buy that property. And I contend that not just the lower priced housing, but the higher priced housing will also suffer, because the people with money who would come into these communities and pay for some of the larger houses and some of the bigger pieces of property are going to be less inclined to move here if there isn't a hospital in this county. The schools would also be impacted. We were talking the other day, we counted up all the kids of people who work at the hospital. There are currently 44 kids in schools in Mineral County that are children of hospital employees. That's a big impact on the schools in Mineral County. 38 of them go here to the hospital or to the school in Superior. That's a big number of kids. So it does have an impact on the schools. One of the big issues that people don't seem to understand is because of the way that the hospital is organized, if the hospital were to close, the debt of the hospital does not go away. We are organized as a hospital district. So there's a hospital district that owns all of the assets and owes all of the liabilities of the hospital. There's also a nonprofit corporation that then operates the hospital with those assets that the district holds. If the hospital were to close, those debts do not go away. They are owed by a governmental entity. They stay on the books, and the taxpayers still have to pay them off, one way or another. So what we're asking is that the hospital be allowed to continue to operate, to work towards assisting with paying off those debts that we owe. As far as the debts go, we have a lot. We have made lots of mistakes at the hospital, and I apologize that we have made those mistakes. But like I said, I can't change what has happened in the past, so I have to go on from here. One of the things we did, in 2009, there was a stimulus bill that passed nationally, and it required that every hospital in the country have electronic medical records, electronic health records. And the funding, especially when it comes to critical access hospitals, was dubious, shall I say. So we had the opportunity to add a layer of electronic medical records onto what we already had, but we decided instead to replace everything that we had, all of our computer systems, with a program called NextGen. And that had everything in it. It had our general ledger, our payroll, our accounts payable, our accounts receivable, everything, plus the electronic medical records. That program and that system cost us $750,000 to purchase. We still owe, as of the end of January, we still owed $600,000 on that software and system. We made an interesting arrangement. We had a leasing company pay NextGen for the software. NextGen provided us with the system, and now we owe the leasing company the payments for the system. And the leasing company does not care whether the system works for us or not. So the system has not been working for us, and we are finally, a year later, we are in a position where the system, we have it under control. And we're getting bills out the door, but we lost a lot of time and a lot of money over the course of the last year trying to make this system work. So anyway, we have about $600,000 that's left due on that. We currently make $15,000 a month payments on the system, plus $10,000 a month payments for the maintenance of that system. So it costs us $25,000 for this system. Again, we could have made a better decision, but we didn't, so we have to go on from here. We also have a credit line with a local bank for about $560,000. What the intent of that credit line is to over the period, the few months that it was taking us to get the next-gen system up and running, that was kind of a bridge to help us pay bills until we started collecting money with the next-gen system. Well, we are still trying to collect a lot of that money, and a lot of it is no longer any good. A lot of it has been written off. Insurance companies, if you don't bill them timely, they say, I'm not paying it. There's a lot and everybody knows the longer it takes to send a bill, the less likely you are to get paid. So we wrote off in excess of $1 million worth of bad debts last year. So we don't currently have the ability to pay off that credit line. It comes due in December, and without some way to pay that off, we do not have the funds available to pay that credit line, and we're not going to have the funds available to pay that credit line. What we can do from this point forward is operate the facility in an efficient manner to make it survive. The problem is we dug such a deep hole for ourselves with all of these issues that we went through that at this point in time we can't fill that hole back up. We don't have the ability to do it. So what we're asking is that the community help us fill that hole so we can carry forward from this point. What the ballot initiative says is, and I will read it to you. Shall Mineral County Hospital District be authorized to make a levy of approximately 49 mills to generate an additional $498,000 for each of the next 2 years to pay past accumulated debt of Mineral County Hospital District? We are not going to pay my salary with this. We are going to pay what has already happened. We will establish a separate fund. Every dime from this tax levy will go into that separate fund, and it will be used to pay off the debts that we have incurred in the past. As the board chair here, John can tell you that that fund will be the very first thing we do when we, if you guys will approve this levy money. We want this hospital to continue, and I truly believe that this hospital needs to be in this county. We will all be injured if the hospital goes away, because health care will be much more difficult to get in the county and much further away. Like I said, we realize that we've made a lot of mistakes, but we're all of us are working hard not to repeat those mistakes. As I said earlier, I was brought here to try and help this hospital survive, and I've been working in healthcare for 34 years, and I intend to not let those kinds of mistakes happen again. So at this point, I will throw open the floor for questions and comments. Yes, ma'am.
Okay, I'm interested in the fiscal side of the house, as John knows. My question to you would be, if the ballot passes and you get out from under the million, do you have enough income coming in currently to be able to sustain the operation without having to do this maybe again at a future time or dig into that line of credit heavily?
I do not want to get into this situation again.
Well,
so no.
Questions?
Yes, she asked if the taxpayers approve this levy, are we generating enough now to continue on into the future and continue as a viable operation? Is that paraphrasing what you said? And the answer to that is yes, we can do that. We have some things that we need to deal with. We've got some issues in a couple of areas, and we've also got some things that, because of the way we were originally organized, we can move some things around, make some changes, and Medicare will pay us better. We get paid based on what it costs us as a critical access hospital, what it costs us to operate. And anytime we start doing things that Medicare doesn't participate in, it costs us money, because Medicare says, okay, you're doing this other thing over here, we're going to take a piece of your overhead, we're going to assign it to that, and we're not going to pay you on that piece of overhead. So what we need to do is make sure that our organization is set up correctly so that we're maximizing the amount that we can get out of the Medicare program, legitimately receive from the Medicare program. And we have not really organized ourselves in that way. So we will be doing some of those things as well. We also have the health center, the regional health center. As many of you know, the hospital does not operate the health center. The health center is a separate entity that is operated as a federally qualified health center. It is operated and managed by Partnership Health out of Missoula, which is another community health center which provides the management for that. We're working together with the health center to try and find efficiencies that we can both benefit from. We need more providers in this community. And if there's a way that we can work together to entice providers to come to this community, we need to be able to do that. And by doing that, we might be able to save some money on the emergency room side of things in the hospital. Emergency room is the biggest cost center in our organization. We pay 2.5 times as much in salaries in the emergency room as any other department in the hospital. So that's a big cost center. Yes, sir, Rob.
When is the election?
The election day is May 5th. However, it is a 100% mail-in ballot in this community. So if you are registered to vote, you will receive the ballot in the mail. There will be no polling places open on May 5th in this community. You should receive your ballot. From talking with Stacey Hayes, they have a window of time that they are required to send those ballots out. They likely will either send them on April 10th or April 13th, and so you should receive them sometime that week.
Disaster.
Yes, sir.
You mentioned the bank.
Mm-hmm.
How much did you say that you owe the bank?
We owe the bank $560,000 on a line of credit, which is current.
And they're going to call it in and work with you on that.
We got them to extend it for a year last December. All it would take was for them to call it, and we couldn't pay it. So operating the hospital is, if we had to attempt to pay that, it's just not, it can't happen.
That's not part of the levy, though, is it?
Okay, the levy, what we're asking for is that if the taxpayers will pass this levy, then we have something to go to the bank and say, over the course of the next 2 years, we have this money coming in, it's going into a specific account, and we're going to pay these items, the next gen system and the credit line with the bank, and that's what we're going to use this money for. It can't be used for any other purpose. And once we have that in our back pocket, then we can go to the bank and say, we have the ability to pay this off. So, yes, sir.
What would the status of the nursing home and the assisted living be?
Okay. We don't have a nursing home. We have a 25-bed critical access hospital, and so in the hospital we are allowed to provide what's called swing bed services. So the entire operation is still owned by the county. There is some debt owed on the assisted living facility. That's part of the money that we owe is on the assisted living facility. Somebody asked the question last night about selling the assisted living facility and seeing if we could do something with that. The problem is assisted living facilities, nobody really wants to buy an assisted living facility as small as ours. A lot of critical access hospitals set up assisted living facilities and set them up under the hospital, and they notoriously lose money.
So would it close?
It very well could.
The nursing home?
There is no nursing home. It's just a hospital and an assisted living facility. So the hospital operates all of those long-term care beds within the hospital. So there really is no nursing home. Yes, ma'am.
So would the hospital stop accepting swing bed, non-skilled patients, which in the public's mind would be the equivalent to a nursing home patient?
Well, if the hospital closed, there is no long-term care available. Yes, sir.
Or assisted living?
Likely no assisted living. I don't know anybody who could run that unless the county decided to run it at a loss. I don't know. So, yes, sir.
Explain the structure of the hospital again. You said there's
Sure.
and who's actually responsible for that?
Okay. There are two entities. There's a governmental entity and an operating entity.
Who's the governmental?
The governmental entity is a hospital district which is part of the county. Okay, so the county has a hospital district within it. Then there is a nonprofit corporation, which is the operating entity. So the nonprofit corporation actually operates the facilities, but the county still owns them through the hospital district.
So who's the nonprofit?
The nonprofit is an organization called Missoula Community Health Services, Inc., doing business as Mineral Community Hospital. It's a 501c3 corporation that has operated the hospital for 35 years.
This hospital?
Yeah.
Oh, I think that's what people want to get rid of.
What's that?
Yeah, let me explain something a little bit more on that. At one point, the hospital was operated by community, and that's where that corporate name came from. The board of directors today consists of the board of directors for the hospital district, who are elected in the county, plus some corporate directors who are appointed by that same local board. It's all 100% local at this point. There was an affiliation way back with community. That's where the name came from. The name has never been changed, but there is no affiliation or control whatsoever coming out of Missoula County at this point. The name is just still sitting there because nobody bothered to change it. But the board of directors that runs the hospital consists of the elected directors that you people elect. I'm one of them. I was elected in May 2013, plus some additional directors who are appointed by your local board. And there's nobody but your local board who has any say over that. There's nobody in Missoula County who has any say over that. Nobody connected with Community Hospital or St. Pat's or any place else that has any say over who's on that board. So it is completely 100% locally run at this time.
John, I'm a little confused with what you said.
Okay.
You said that there are appointees by the local board. Who's the local board that makes
The board that you elect.
Right.
Oh,
The board
okay,
that you
I see.
elect that
I
then
get it.
fills the additional seats
I get it.
in the nonprofit, but they're all local.
Did the board know that we were getting in this big of a problem?
Well, you know, I came on board in May 2013, and at that stage of the game, the board was not receiving good financial information. So I don't believe they
From
really
who?
did.
Yeah.
From the management. And again, that's something that has happened in the past. Once I got on board, I started pushing to get those financials to the board. We are now getting them very regularly. I can tell you that Ron, and I invite any of you to come to one of our board meetings, they're open to the public. Ron does a great job of making sure we have a good, solid look at what the financial situation is. He reports to us every month in detail. We get a package ahead that's got the information in it so we can study it before we get to the meeting. And I can tell you also, one of the things I've been doing since I've been on the board, is pushing hard to make sure that we have a very strong board. The board elections in May, there were 3 positions open, mine and 2 others. Only 2 people filed petitions, so they're unopposed, and they're not going to be on the ballot because they're unopposed. One of the other person besides myself that filed a petition is somebody I recruited because I was very comfortable that they were knowledgeable and strong, and you might as well know exactly who it was. Many of you will know her. I recruited Peggy Temple to go onto that board. Peggy has a great deal of financial experience. She was a chief financial officer for a city for many, many years. And those of you that know her also know that she's not going to sit back. She's going to ask questions. And we're working really hard to put that kind of board together. We're interviewing Thursday to fill a vacant seat on the corporate board. I think we've got 2 really good candidates again with a lot of business experience, and we're pushing real hard to make sure that there is a board that will ask the right questions and do the right kind of oversight. By same token, I think with Ron, we've got a leader who's going to make sure we know the right kind of information too.
And then you said that, so there'd be you 3 appoint other people to be on the board?
It's more than 3. It's, let's see, what is, I
Well,
think
how
it,
many were on this board?
There are 5 elected people, and then they appoint 4 additional people. So the total number of people on the board is 9. Plus then a county commissioner sits on the board as an ex officio.
So 10 people let this problem happen over how long of a period of time?
Forever.
No, I mean, you came on board when?
November 3rd.
Not him,
This year.
but you, sir.
I
Are
came.
you pre or after?
I'm after.
We're going to sell the hospital
The-
to this high-tech company and build a new one.
I'm after. The decisions that were made that are
But
causing.
were you pre or after this regional nonsense? We're not a region. Missoula's the region. Look at the map.
Yeah, I'm after. When I came
But
on,
if the hospital closes, does the regional thing still stay open?
The clinic still stays open.
The clinic
it's not
stays
it's
Well,
not
it
part of the
doesn't sound
hospital.
like closing is closing then.
well, no, the clinic is no overnight. It's no emergency room. It's no beds. They're separate entities, and I don't know whether the clinic survives or not. Quite honestly, one of the big problems if the hospital closed that haven't been talked about here tonight is that, and you know, we've had trouble keeping doctors in this county. The compensation package for a doctor in this county is a combination of what they get paid to work the hospital emergency room and what they get paid to work the clinic. If the hospital closes, a bunch of the doctor's pay goes away, and I'm not sure we'll keep a doctor for the clinic either under those circumstances.
Well,
He said he just came on in November.
November.
Yep.
So, and you had 10 people on this board. Okay, so when were you aware that this problem? I mean, it just didn't happen within 6 months.
I came onto the board in May of 2013, and when I came on the board was not getting financial information. I started pushing right away. It took several months to start getting the kind of information because people weren't used to being pushed for that. And we're getting that good solid information now. But yeah, when I came on, the decision about the next-gen system had been made. All the decisions that are causing us so much heartache now have been made.
Well, you were on the board. Did they ask you for a vote to do this? Or did
I was not on the board when that happened. That happened before I came on the board.
aren't you just pointing fingers now and you said you didn't want to do this? Now, is
Well,
this a tag team or one guy?
Well, I'm trying to answer a question. You're right. I don't
It's a
want to.
voluminous answer, and finding out who approved it when is beside the point.
Well, I agree.
And I think, you know, to get a tag team of you represent the hospital and gee, you represent the hospital, you represent the hospital.
No, not me.
Now you said financial side, you're in with them. Maybe you do, who else
No.
does? But I got
No,
something else
I
to
need
say.
to clarify this. I am here as a citizen of Superior. I do sit on the board of directors for the Western Montana Mental Health and for the Child Development Center, but they are completely separate from this.
It
They have
just
nothing
sounds
to
like
do
a
with
bunch
this.
of really
I'm here as
And
a
by the way,
citizen.
the regional part wasn't mentioned in here at all.
What regional part?
Oh my
We
God,
do,
the
we
thing
do
you
not,
just
we
talked
do not operate the clinic.
Yeah, I know that, but it's not in here.
Well, it's because we don't operate it.
Can I speak, do you mind if I take just
Yes.
a moment to speak
Sure.
to this?
Sure.
Okay. As I mentioned to you, I represent our county with the Western Montana Mental Health and the Child Development Center. Here's this gentleman over here. I don't want to remember that. I'm sorry. I can say, having sitting on those two boards, that there are a lot of changes taking place. And we all know that there are a lot of changes taking place in the medical field, some imposed, some not imposed. And as has been lined out tonight by Mr. Gleason, we definitely do have some serious problems here in our burg, in Superior. Yes, there were some decisions that were made that were, well, I'll say unfortunate to be generous. Let's just put it that way. But the reality of the situation is that I believe that we need to be looking at this, looking forward, not worrying about the past. I can tell you that these decisions that were made prior to John and certainly prior to Mr. Gleason. And what they are attempting to do is to inform the community about the situation that we find ourselves in and formulate a solution to help us to get out of this situation.
So now it's a
And-
three-part tag team.
No, it's not.
I want you to stop talking.
Well, but
Just
stop
stop
explaining.
explaining.
So,
What-
do you,
did
do you want
know where
to, do you want to come up
Do
here
you
and
know
talk?
that you moved to Love Connect?
Sir, you seem to be saying that anybody who holds an opinion different than yours is
She
on a
just
tag
says
team.
she's on two boards. That's like your board.
Two boards
and his board.
on an entity that has nothing to do with the
Okay,
hospital.
let's move on. I think you've made your position very clear here.
No, you
So
haven't.
let's move on to somebody who has some legitimate questions.
I
Yes.
just want to know, was there ever thought of selling the hospital to, say, St. Pat's and let them, and then, do we owe anything on the hospital? Let me ask you that first.
We owe about $2.6 million
Okay, what is the
in debt.
hospital worth?
Nobody wants to come and take over the hospital from St. Pat's or community.
Why not? Why wouldn't they want to do that?
I have talked with them. They're not interested in it. They've got their own problems.
Well, we work with them every day.
Actually, we don't work with them very good. We send patients to them.
Well, yeah, almost everybody that has.
Yeah, and I'll tell you,
they wind up there.
they're very worried about this hospital going away. I had a conversation with the pathologist who oversees our lab out of Missoula Community, and she came in and she said to me, the physicians in Missoula are extremely worried that this hospital will close, because if this hospital closes, they're going to be seeing much worse patients by the time they get to Missoula, especially trauma patients that don't get stabilized. Those kinds of patients, they are very concerned that they're going to start seeing patients that are in far worse condition. I think you'll be seeing a letter to the editor from that physician out of Missoula soon in the local paper. While they know that we need to be here, they've got their own problems right now. St. Pat's and Missoula Community have a lot of issues that are staring them in the face.
Well, I was just saying if we could sell it, and it would take care of the debt that we owe.
If we could, it would.
Yeah,
And
if we
we
could.
sure did explore that. At the point where some of you may remember a couple of years back, there were articles in the newspaper about St. Pat's cutting millions of dollars out of their budget. And they were doing that at a time when we should have been doing the same thing.
So whatever brought out the fact that the community actually ran the hospital at one time. and then we took over.
That was
That
probably
was
in
a
the
long time ago.
1970s.
I have no personal knowledge other than that was long before I was here.
Yes. Yes, sir.
Two-part question.
Okay.
One is, as I see it, your major problem was your billing system, the failure of it.
That was one of the big problems, correct.
Well, writing off $1 million is tough for any business.
Yes.
And I don't know what else is on the books and what is not the bill. But has that been resolved? And will it be resolved in the future?
Yes.
The second part is, you're saying you want 49 mills. Is that in addition to the 30 mills we're currently paying?
Correct.
So it'd be 79 mills total.
For 2 years, correct.
Now, the system that brought this all about was your new computer system. And for years, nobody seemed to be able to make it work.
It was installed 1 year ago.
Right, but nobody seems to be able to make it work. I don't think any business can exist long beyond 2 weeks with a computer that doesn't work billing-wise.
Correct.
Has that been resolved, and is it going to be okay in the future?
Yeah. What we have done is we are on our 5th person from NextGen who is supposed to be helping us with the system since we installed it. Finally, we have someone who understands. NextGen is no longer installing any systems anywhere, which is not surprising. But the people who were doing the installs are now doing support. And this person actually understands what's going on. Our biggest issue that we had was that from the clinical side, getting information into the system and then getting it over to the billing side and being able to bill it out. If you don't get information in on this side, then the people on the billing side are out trying to track down charges. Okay, we have that issue resolved. We've been doing lots and lots of training since I got to the hospital. Our physicians and our nursing staff understand much better exactly what needs to go on in order to get a bill out the door. For the first time since we installed NextGen, we will actually at the end of March be able to close March with all of the charges in it shortly after the end of March. So that's a huge plus.
That's 6 months old, hasn't been billed to the insurance company.
Okay.
That doesn't show good performance.
Yeah. Like I said, we are working on current stuff. There's a lot of old stuff out there that just didn't happen.
Are there other hospitals having trouble with the NextGen?
Yes. Yeah. As a matter of fact, there's because of the way we organized the purchase, which was not a great idea. We approached our attorneys to see if we could sue them. They wanted a whole bunch of money. They don't take things like this on contingency. So we just don't have the money to sue anybody for this kind of thing. Plus, not really sure with the way that our contracts are written, so that triangle is there that we could get anything. There is another lawsuit out there with a couple of Montana hospitals who did not end up installing the system because it was so they were so far behind in getting certified for the electronic medical records piece. So NextGen has had lots and lots of problems. NextGen is a very good clinic system and has been for years. So on the clinic side, I installed NextGen at the hospital in Chester. It works very well. The problem is they decided that they were going to be a hospital system too. They went out and bought an unproven system and then started selling it. And we bought it. So the hospital side has been a real learning curve for NextGen as well as for us.
Ron, this lady's had
Yes, ma'am.
Do you think that a labor and delivery unit would be for a shoulder?
Labor and delivery is something that she asked if a labor and delivery unit could happen here in Mineral County, and the answer is no. Labor and delivery is extremely expensive to operate. We probably were doing, by the time we closed it down, we probably had a dozen deliveries a year that we were doing. In order to do deliveries, it probably would cost about $100,000 a year for medical malpractice insurance. Then you have to have physicians who are capable of doing C-sections in your facility and on call at all times. You have to have nursing staff who is OB trained on call at all times. You have to have anesthesia services available at all times in case you need the anesthesia services. It is so expensive to operate that it's not something that we can actually do the deliveries here. However, what we can do and what I'm working on is trying to figure out a way to get prenatal care into the county. If I can figure out a way to get prenatal care here so that the same providers who are doing the prenatal care can do the deliveries in the other location, then what our facility can do is we can generate some revenue off of that ourselves. Because what's happening right now, when somebody goes for prenatal care, which is really poor in this county to begin with, but when somebody goes for prenatal care, they go to Missoula, and then Missoula gets the ultrasound, they get all the lab work, they get all of these other things, all of these things that they can charge for, they keep in Missoula. If we were able to get an OBGYN or a primary care physician who provides obstetrical services, prenatal care to come here, then we could pick up those ultrasounds and we could be doing the lab tests and people wouldn't have to leave home to get that prenatal care. Right now, I think one of the reasons we have such poor prenatal care is because the distances are so great, people just don't do it. And if we could get it here in the county, it would be better. Yes, sir.
Since we're part of the Western Montana medical community, is there any chance of tapping into the sale proceeds from community hospital?
I went and asked that question to Steve Carlson before he left community hospital. The way that my understanding, the way that is going to be set up is as a large trust, and they will be giving grants off of the income from that trust, so that the basic chunk of money is just going to sit there and generate income, and then they'll give grants off of the income. What I was told by Steve Carlson is you might as well go out and buy a lottery ticket as opposed to getting some of that money. So I was going down the same road you were, but chances of us getting any of that money are pretty slim.
And with that model, until such time as it generates some income, there's nothing there to get.
Right.
When they do it that way.
Yes, ma'am.
So, we were talking earlier about what would happen if the hospital left and how it would impact the clinic. One thing that I can see just us talking here this evening is the fact that the lab would be gone. And
Correct.
any physical or any lab work, any blood sugar tests, any just normal basic routine type things, people would have to go to Missoula to get it done.
Correct.
And then people would find a doctor there or different things. So it all just kind of filters away if you don't have a lab here.
Sure.
To
We also have X-ray too.
Right,
I mean, so
exactly.
X-ray services, mammography services, CT, MRI, ultrasound. Our ultrasound is increasing the amount of ultrasound services
That's
we're
not
providing.
attached to the clinic. I mean,
Correct.
they
That's
can
in the
ask for those
hospital.
tests to be done, but lab work usually is like for routine physical and things like
Sure.
that, which
Sure.
has got to, be here.
Yeah.
I just
Yes,
wanted
ma'am.
to add, we also have physical therapy.
Correct.
We have our specialty doctors that come here for specialties, colonoscopies, our ear, nose, throat doctor is here. We have a lot of services to offer.
We do. We do.
And getting back to those costs that we're gonna lose, is that one trip in the Missoula to have that lab work is gonna cover that little mill levy that we were paying each year. And if we
Ron?
have to go in for a
Yes.
couple of tests, we're gonna be down.
Agreed. Yes, sir.
I'm a little confused on, we got in this situation, are there any of the people that got us here still on a board, or did any heads roll? And what
Well-
I'm trying to get at, that's the first part.
The,
Go ahead.
yeah, the CEO is no longer here.
I know that, but what about the
Yeah.
people that, to me, there's a couple of things. If I went out and bought a computer system that cost me $750,000, I'll guarantee you that them people are gonna be sitting right here next to me until I got this damn thing figured out. So somebody let
They
that
are now.
slide.
Yeah.
The board members that didn't demand the CEO to give them some kind of a record should not longer be here.
One of the things that happens with the board that you need to understand, and I mentioned earlier, there were 3 openings in May and only 2 people filed.
I understand.
The way you change the board is by more people in the community stepping up.
But what I'm getting at is, we didn't know what was going on as the community.
Right.
The board members were supposed to be doing their job.
Yep.
They didn't do their job, so if they're still around, why?
Now, there have been a lot of changes on the board.
And my second part
Sure.
is, you've mentioned Medicare and Medicare and Medicare. What trouble has Medicaid put us into in this community?
Medicaid is a big issue. We have lots of unemployment, like I said before. Medicaid is a major issue for us, and I am a pretty conservative guy myself, but one of the things we have to do is we got to come up with a solution to Medicaid expansion.
Yeah,
It needs to happen.
I'm here just like John and this lady and probably a bunch of other ones, because we had a hospital, we had a grocery store, we had this, that, that's why I retired and moved here. But here's the thing. I'm listening to politicians talk tonight, because if I remember correctly, 8 years ago, somebody told me that they were going to cut government and cut taxes. We're over $18 trillion in debt.
I
so
understand.
What I'm getting at is, you're sitting here talking and telling, but the proof's not in the pudding to me.
Okay.
Because down the road, you're going to be gone, and the next John's going to be here saying the same thing you're saying.
You know, one thing Ron didn't tell you tonight is why Ron chose to be here, and I think he needs to do that right now. I think that'll answer some of the "you're going to be gone."
Yeah. I came here from Havre. I spent 25 years in Washington State. I grew up in Ronan. My parents still live in Ronan. My dad's 80th birthday will be on April 25th, and we're having a big shindig over in Ronan. I didn't come here to leave. I intend to stay here for the rest of my career. I want this hospital to work. I have a track record of helping small hospitals and helping them survive. Like I said, I spent 25 years in Spokane. All I did in that 25 years was work with critical access hospitals, little hospitals all over the country. I left that job, and because it was basically tearing me to shreds. I was spending way too much time going out and finding work instead of actually helping people. So I quit that job. I went to work for a small hospital. I went up to Chester 8 years ago. That hospital was in very serious financial condition. They are right now a thriving little hospital. I intend for this hospital to be the same. The problem is the hole that has been dug is so deep that I don't have the ability to fill that hole with the revenue we can generate. So.
You say this is only going to be for 2 years. What guarantee do we have this is only going to be for 2 years?
Yeah.
I mean,
well, nothing
they
is.
always tell us 2 years, and then it stays and stays and stays.
Yeah.
So that's my question. You know, how do we know it's only going to be 2 years?
Well, number one, you're right. Nothing is guaranteed. I mean, I might drop dead tomorrow. I mean, nothing is guaranteed. Yes, the question was, what's to guarantee that 2 years from now we won't be coming back to ask for more money? Life is not a guarantee. However, I can't pass a levy. That's you guys.
Well, I think
I'm one vote.
The hardest thing
So.
is that probably, well, at least the older people here anyway that are retired
Sure.
are on a fixed income.
I
The
understand.
majority of them are.
Understand.
And so increasing their taxes $100, $200, $300, that's a chunk for them.
I understand. I
You know,
understand.
not everybody, you know,
Yeah, I mean,
is able to do that.
I guess one thing we have to say about any of this is that I think you all know that there's a lot of things that are very much in flux about medical care at this point.
I know we need a hospital here.
Yeah.
I mean, he was saved last year, a year ago,
Sure.
you know. But-
Well, and we get, I have a card in my bookshelf in my office that was from a young man, and all it says inside of it is, "Thanks for saving my life." That's all it says. That's all the card says. But that card means more to me than a lot of the things I've ever received. So,
I think that's a lot of people's worry is this gonna go on forever?
yeah.
Well,
That,
it's just like when we moved here 9 years ago, property tax is $700 a year. I got a statement right here, it's almost $2,000 a year. Whoops.
yeah.
And
Understand.
now you're wanting another $200 or $300 to put on top of the 2,000. Now we're at 23.
That's
2
right.
years. It sounds like we're at an auction.
Understand.
Yeah.
Understand.
I think that basically is what generated the question about us being able to continue with the revenue that we have
Right.
coming in now to maintain the services that we are providing.
Yeah. That's my job.
Your
And
job is to be correct.
yes, sir, Roger. Oh, I'm sorry, Mike. I got to go to Mike first.
You're here, basically here today asking us for money.
Correct.
Okay, you threw out some figures, 600,000, 500 some thousand, and then a couple of minutes ago you said 2.3 million.
Right. There's another. That's not all of the debt we owe.
So there's 600 and the 530 was it, or 580?
Yeah. There's another 1.2
Money
out
you're
there.
asking
on top of
for
that.
the 49 million?
Correct.
Okay, for 2 years.
Correct.
Now you know what the tax base is, you guys got this all figured out. Is that 49 mils for 2 years gonna pay off at least that 600 and that 500?
Along with us kicking in, yes, it will. Yeah.
So in 2 years, we should have those two debts gone down the road.
That is our plan. Yes.
And the money will not be used for anything else.
It can't be.
It will be put in an account and used for nothing else but paying down
And
that debt.
it's gonna be open doors and
Absolutely.
Yeah. The board meetings are open public meetings. Anybody who wants to come to a board meeting can come to a board meeting, and I would love it if people did come. In the last couple of places I've been to, lots of people come to the board meetings, but here it hasn't been the case.
After a year to come and see, okay, where are we at?
Sure. I would like for you to come to every meeting so you can see what I'm doing.
Listen, I mean, I'm not real good, but if you bought the computer system in 2009, correct?
No.
When did you buy it?
We bought it, it was installed on March 18th of 2014. I think they bought it a year before that, but,
I thought you said 9.
yeah. Well, 2009 is when the law came into existence that said over the next period of time, you have to get to what's called meaningful use of electronic medical records.
That's why.
So, yeah. Yes, sir, Roger.
Ron, you made a comment last night that meant something to me, because it sounds like people are wondering what's different now compared to 2 years ago. You made a comment regarding having information and the ability to solve problems. Can you go over that again?
Yeah. What I said last night is I'm an old-time CPA. All that time I was working with hospitals. I was working as a public accountant, and I'm a finance guy. And I grew up that what you can measure, you can manage. And the board here had nothing given to them that gave them any way to measure anything. And it's very difficult to manage anything when you can't measure it. I will give the board so much information they'll probably get sick of it. But I started out with providing them with a set of graphs, and now it has expanded. Next month it will expand further, because as I am able to spend some time doing this stuff, I can give more information to the board, and they can see what's going on. We have there's a group out of University of North Carolina that takes the cost reports for every critical access hospital in the country. It accumulates the data, and then it provides information to every critical access hospital on where they stand compared to their peers. So our board gets now information that shows here's the information for facilities our size across the country, for Montana critical access hospitals, and for all critical access hospitals in the country. And here's where we are, and here's where we've been for the last 4 years. So that they can tell if we're making progress. And I'll tell you, a lot of this stuff looks like this over the course of the last 4 years. Our goal is to make it go the other direction and get to the level where we are comparable to those other facilities that we're trying to be comparable to. And a better goal would be to be better than they are, because that's just the average, and nobody wants to be average. So, yes, ma'am.
In the future, when you guys, if you guys get into talking with the renew something or get a new system, what are you going to do to help us spend? Or go into further debt? Are you going to come to the community and
the question has to do with if we have to replace the system that we're currently working with, what are we going to do? I think next gen, over the course of the next, we are stuck with next gen until at least 2018.
well, any debt?
Sure.
Any
Sure.
debt that you guys have to get into, are you going to come to us and put a levy on the ballot saying, hey, we have to?
No, that's not what I would like to get to the point of. Right now, we already have some money on the ballot, and what we were able to do in Chester is get to the point where every dime from the money we were getting from taxes went into an account called funded depreciation. And the board had control of the funded depreciation account. And if I wanted a new CT scanner, I went to the board and said, can I use some of this money from the taxpayers to pay for this new CT scanner? Because right now there's a couple of different levies out there. One of them lasts till 2023. We already get some tax money that I would like to get to the point where we can take that and stop paying my salary with it. That we can take that, put it into account, and then when I go out to meetings like this, I can tell you exactly what I spent it for. Because that's where we were in Chester. I was able to say, here's the money you gave us, here's what I spent it on. And it would be nice to get to that point. We aren't there yet. This gentleman up here was.
I got a question. I guess let's just cut to the chase. I got the chairman of the board here and you got yourself, and you've discussed what could happen. I know you all have quite at length of what happened if this new levy goes down. You've got a plan B, I hope you got, and I want to know what it is. Is it cutting some staff to make this place run? If it doesn't pass, what is your plan? Or are you just going to say, oh no, hospital's done?
We're not gonna give up, but it makes it very, very difficult for us to survive. Would we lose some services? Almost undoubtedly. We would probably lose some services. We are part owners of a magnetic resonance imaging MRI system that comes here every Monday. They have offered to buy that from us. We get better prices right now because we are one of the part owners of that, but we would probably have to stop that. Right now, it costs us a lot of money for 2 more years. We've got some money coming from the Helmsley grant to pay for our digital mammography. When that money runs out, it costs us $40,000 a year for the maintenance on that, $34,000 a year. I think that's what it is. On the maintenance on that MRI or that mammography machine. We may have to stop that. There will be things that we can do. But what you also need to know is we've already done some of those things. 2 years ago, we were at 95 full-time equivalents. We're now at 71, and I see that number going down. We have been cutting our overtime. Our employees who are union employees decided to take less of a raise this last year than their contract called for. We no longer provide dental or vision insurance. We no longer do the 3% match on the profit sharing plan. We have made some serious cuts, and our employees have taken some serious decrease in compensation because of those cuts. So we are doing those kinds of things in addition to what we're talking about here.
So you are saying that the hospital is not going to go close the doors if you don't get the mill levy, because that's what it's.
I cannot say that. I cannot say that it will stay open.
No, what we're saying is that we won't quit, we won't give up, that we'll do everything we can to keep the hospital alive, even if the mill levy goes down. But we're also saying we don't see a clear path to keeping it alive if the mill levy goes down. We've already made a lot of those cuts, we've made a lot of those changes, and we're not seeing a clear path at this stage of the game. We'll try. I'm not going to sit here for 1 minute and tell you I wouldn't try, that I'll just throw up my hands and walk away. I don't function that way, and I know Ron doesn't either. But I can't promise you it would continue to live.
But I'll guarantee you, if the levy goes down, I won't buy a house here. I mean, that would. I'm an old-time CPA. That would be a terrible investment.
You know, they
So.
got these trucks back when down the match went down, and they lost 300-400 jobs. We got this whole community thing, but they have anything amazing. We still have community, and we still have this and that. And the house prices didn't go down either. So, you know, the scare tactic of when the government lose everything out.
Okay. I don't agree with you, but we'll agree to disagree. Yes, ma'am.
It's true that a lot of people have to leave town, and a lot of things happen when everything, like all the lumber mills die. But the hospital is a service. It can still do the job. It didn't. I don't know. It's a dilemma. I'm glad it's not mine.
It is yours, yeah.
Roger was next.
got one vote.
You know, I'd like to speak to something. I know most of you here. Some of you I don't know. I know that most of you here obviously have served your community and your country. There are a lot of veterans here too, so you know what sacrifice is. And interestingly enough, I'm a veteran. I was a young officer in Vietnam. You know, we make mistakes. I was a senior person in a major corporation. We made mistakes. Mistakes are made all over. But 90% of the time, we did not make mistakes. We did not point fingers. We looked at what we did, we corrected it, and we moved on. Now, I attended this meeting the other night in Georgia, and I came home to Trestle Creek, and I was thinking about where in the heck is my obligation here to this community? Now, if I were a Hollywood writer, what's going on here, I would write a script in the 1930s, and I would be in Oklahoma in a Dust Bowl. I would be getting my Model A and my Model T and my family together, leaving my home and heading to California. Oh, beautiful. John Steinbeck wrote a novel about it. Well, what the heck? For 15 cents a day, for 30 cents a day, for most people, for me it's going to be 60 cents a day. I'm not going back to the 1930s. Now think about that a little bit, people. Think about this. This is the 21st century. And we're talking about going back to the 1930s. This hospital has been here since the 1900s. Go in the lobby and look at the pictures. What in the heck is going on here? Mistakes have been made. What it speaks to, very simply, is character. And every one of you have it here. Every one of you has character. Let's wake up. Now, I'm the one. Ron can't say this. Now, let me talk to you about character. And I'm not going to preach too much about this, but I'm going to preach it more because I'm invested in this. Do you realize, and I happen to be chairperson of the foundation here, Ellie and Judy Menson, many others, Carol, Gillette, I can name others, other people, Maggie Dahl, people that you folks know, who have been on this foundation. Do you know how much money you folks have voluntarily given the last 10 years for this foundation attending our fundraisers? You have given over $200,000. For what? For the clinic and the hospital, because you have character. Now, are we going to sell our character for 15 cents a day, or 30 cents a day, or 60 cents a day? And I talked with another person who has $700,000 worth of real estate. That's going to cost them $460-some a year. And they're not going to sell their character out. We're not going to sell their community out. It is damn un-American. It is un-American. And I personally won't stand for it. Now, someone can get into a spitting contest with me, but these people here have dedicated their lives as you have. It's not in our character to let a hospital go. In the 21st century, in the 1930s, it was probably true. It was probably true when we had 30% unemployment. People would walk away. We've got the promised land here. We don't need to go to California. Thank God we don't have to. But I've said enough. But I just want you to think about that a little bit. For 15 cents for most of them. For 30 cents. 30 cents. And you're going to throw good doctors out, throw a hospital out, throw nurses, throw all of your community out. And I'm not even native Montana, but boy, I sure talk like it. So I've said my speech. And if you disagree with me, hey, I'll buy you a cup of coffee.
Roger.
I know, you know that will cost me $1.
Roger, I don't think necessarily that anybody is here saying that they're not willing to pay to have the hospital, but I will tell you one thing that irritates the hell out of me, and that is whenever something goes wrong, you want to go to the property owner and ask for more money to bail you out. That's just simply the fact about how I feel and a lot of probably other people. But that doesn't mean that I'm not going to pay to keep the hospital, but it always comes back to the taxpayer. Everything comes back to the taxpayer. And we only have so much money to go around.
I understand. I understand. Yes, sir.
Previously, that's a principal thing. See, some federal grant, or there was a program for rural hospitals. What happened to that if there was?
The program that we work under is called Critical Access Hospitals, and right now the federal government is trying to diminish that program somewhat. I think that there is a perspective in Washington, D.C. that considers us out here to be flyover country that really doesn't matter. I was involved with a project a couple of years ago called the Frontier Community Health Integration Project, where we were trying to get Critical Access Hospital back to what it was originally intended to be. The way that Critical Access program was formed, it was right here in Montana through a demonstration project that CAH was born. They were called medical assistance facilities. And there was a bunch of the facilities that got together and said, we have to do something different. They got a demonstration project and it became Critical Access. The problem is when some of the other states saw what was going on here, they said, us too. And the original rules said that Critical Access hospitals you had to be more than 35 miles from the next nearest hospital. You had to only have 25 beds in your facility. Then there's a whole bunch of rules about what you have to provide and times for having providers in your facility, those kinds of things. That program exploded, and soon there was 1,800 Critical Access hospitals around the country, including one in Pasco, Washington, of all places. So the Critical Access Hospital program was carried far beyond what it should have been. So we tried to go back and start over with CAH and say, we need to take it back to what it was. And we need to look at these facilities like Chester and Superior and Circle and Jordan and Ekalaka and Terry and Forsyth. And these little hospitals are so far from other facilities that they need this program in order to stay alive. Instead, what's going on at the federal level right now is they're saying we're spending too much on critical access hospitals, so we're going to cut everybody. We need to fight that. I believe, I went back to a meeting at the White House in 2011, I think it was, to talk about this very specific issue with a group of people. And what I told that group is we have a different perspective on what rural means. A completely different perspective. It's not Virginia. I'm sorry, it's not. You guys think Buffalo, New York is rural. I think Buffalo, Wyoming is urban. That's where we're coming from. We brought some people out here. They flew into Billings. We took them to Forsyth, Ekalaka, Terry, Circle, Jordan, and then to Lewistown. They understood, those people understood what rural it was by the time we got out of there. But I can't just stop with trying to make this work within this hospital. The state of Montana, we need to stand up and say, we need these hospitals in our little communities, and we need to not let the two coasts destroy what we have, because they're working very hard at it right now.
I think that most people don't mind paying for the hospital. What they object to is paying for other people's mistakes. And yeah, we're looking back. Oh boy, are we ever?
Yeah.
But
Understand.
That's enough. You say.
Understood.
Yeah. Yes, sir.
We moved here about 11 years ago, and when we moved here, we had to have a doctor. So we came down to the hospital, and all we wanted to do was meet the doctor. Okay? So we went in, he introduced himself and stuff like that. I shook his hand, and we walked out. We got a bill for $100 for shaking his hand. Okay? We got, actually it was two bills. She got a bill and I got a bill.
Okay.
So we said, well, probably just a big mistake. So I came here for a ear infection. So I gets here and I told the lady, I said, I got an ear infection. I've had a lot of problems with my ears and stuff like that. She couldn't figure out how to turn the thing on to look in my ear. So I had to show her how to turn on. I don't know nothing about that, but I had to show her how to turn the thing on so she could look in my ear. She says, well, there's nothing we can do about it. So I went to Walmart and got some Euro, poured that in my ear, and within seconds, my ear was dead. What I'm trying to figure out, if you're going to reduce the amount of people that you have and the amount of hours that they're allowed to work, how are you going to give us better health care?
Number one, we don't run the clinic.
So,
Okay, we don't operate the clinic. That's not, the clinic is operated by a separate entity, that's not us. We operate the emergency room, we operate the hospital, the assisted living facility, and the inpatient acute care operation within our community. So I can't speak to what happened, you know, when you came here. All I know is we're living by a different code now. When I came to the facility, we started instituting some very specific things. One of the things we do now is we try and live by 7 promises that we make to each other every morning. We get together 9 o'clock and we make promises to each other that we're going to live and do better. For example, Monday's promise is responsibility, and it says, I will take complete responsibility for my health, my happiness, my success, and my life, and will not blame others for my problems or predicaments. And we're trying to live by codes like that. Sunday's faith, my faith and my gratitude for all that I've been blessed with will shine through in my attitudes and in my actions. We're trying to live by a different set of codes so that when you walk in the door, you're treated like family. And I can't say what happened last year or 11 years ago. If you're not treated that way, I need to know about it, because we train people different than that. So, yes, ma'am.
I've been listening, and I've also heard this. this meeting tonight, that the confidence in the basic management of the hospital is really very low, unfortunately because of past actions. So my question is, what are your plans, the board and you, for training the board members so they have a clear understanding of their responsibilities, especially fiduciary right now? And what are your plans for making sure that the people who are newly elected to the board will know exactly what their responsibilities are, other than just going to the meeting, never asking a question, and saying aye?
Yes. We have a specific guide that has been put together that is a training guide for new board members. One of the things that we are doing now at every single board meeting, and we'll be doing it into the future, is we're trying to train our board. We're trying to give them more information. Now that we've got them financial information, the next board meeting on our agenda is we're going to talk about EMTALA and what EMTALA means. That's the Emergency Medical Treatment and Active Labor Act. That's what holds us to every time somebody walks into the emergency room, we have to treat them. We have to do a medical screening examination for them, regardless of their ability to pay. As a matter of fact, we can't even ask if they can pay. So we have to live by, there's a lot of rules in healthcare. We're the most regulated industry in the history of the world. And we have to live by that. But the board who is operating the organization and who is responsible for oversight needs to know some of those rules. So we're going to be talking about those specific rules. Like I said before, the board is going to get sick and tired of the information they're getting, because they're going to get a lot. I send out an email, I don't know, sometimes 3 a day to board members that is information for them to read. At least a few times a week, I've got something on the email that says, you need to know this, you know, for your information.
I think it might be prudent to somehow list the current board of directors so that folks know who's really on there and who isn't on there, because I know there's been a lot of changes, you know, and that might be helpful, and it will also help them at election time, whether they decide if they want to re-elect someone or not. And I guess my major concern is, yeah, the board will get a lot of information, but are they going to know what to do with it? That's my real concern.
And John is working very hard to get people on the board. He's the board chair, so he's working very hard to get people on the board now who really know a lot about not just healthcare, but about business in general.
Oh, good.
So,
I mean, I've mentioned Peggy Temple, and I'm sure many of you know her. And I kind of chased Peggy around for a little while and pushed her to get her to come on that board. And she was a little reluctant just because she's got her doing a lot of other things, you know. But we're, you know, that's the quality of people we're looking for the board. I'm pushing for that. On the education, Ron and I meet every other Monday. We talk about what's going to be on the board agenda. We talk about what we need to be focused in on. And so we spend a lot of time, too, working on making sure the board does get that education.
With the legislature in session right now, the board is getting emails twice a week on what's going on in the legislature.
I feel really comforted by the fact that you're addressing this issue, because these folks are the governing body. They are the ones making the decisions. They are the ones that said okay, maybe unknowingly, but you know, nonetheless, they did say okay, and so I feel really good about the fact that you're proactively addressing this issue and recruiting for specific talents that you need for the board.
Yes, sir.
Not being disrespectful, Ron, but you mentioned cut out the eyeglasses and all that stuff for the employees. Is this you too?
Oh, absolutely.
I mean,
yeah.
the benefit, I mean, your salary is your salary, and that's.
I don't get any benefits that anybody else doesn't get. So.
And correct me if I'm wrong, but I was informed that the late a brand new Subaru.
I've heard the Subaru story, and I don't know what happened or what, you know. All I know is right now I'm driving I think it was an Avis rental car, and it's an Impala. I'm not driving a brand new Subaru.
The Subaru that was purchased has been sold.
Okay.
The thing is, I mean, a CEO in New York, they get all kinds of benefits.
Yeah.
If you're not in New York.
I took a pay cut to come here.
Probably not big enough, but you know, we'll go for
So I wanted to be here.
Okay.
So.
Thank you for coming.
Sure.
Is any of that, you know, the federal government hasn't, you know, like the county is going to be hurting next year if they don't come up with this rural money.
Yeah.
Is that going to also affect the hospital? Because if it is, you know, I think the only one, if that money doesn't come through, okay, the county is the only one that can raise the mill levy for the taxpayer without a vote, if I'm not mistaken. I'm not quite positive,
Yeah,
but the hospital can't and the schools can't.
Correct. I don't know that the county can.
Is that going to affect the hospital?
It will definitely affect the hospital, not directly in the form of tax revenue, but whatever happens to this county happens to the hospital. And so when I went, I spent about an hour and a half with Senator Tester's healthcare aide in Missoula a couple of weeks ago, and we talked about a whole bunch of issues related to the hospital, but we talked about secure rural schools too, because if this county loses that kind of money, I told her there's one of two things has to happen. You either continue with that program or you let us cut some trees, for crying out loud. One of those two things has to happen, because if it doesn't, we're not going to survive as a county. I mean, there's certain counties there was one county in Oregon that loses 80% of their income if the Secure Rural Schools program goes away, because they won't let them cut any trees. So
How far in debt do you have to be before you can file bankruptcy as a county?
You know, I don't think it's ever happened in the history of the state of Montana, so I'm not really sure what that number is. You couldn't just file bankruptcy as the hospital in order to get out of that debt. You'd have to file bankruptcy as the county, because it's debt of the county. So if the Secure Rural Schools program goes away, I don't know, maybe there is something that I don't think anybody's ever done it in Montana, but maybe there is something that could be done. Yes, ma'am. Hi.
So, if the hospital did close, I have an 8-year-old that most of you have seen. If a hospital's not here, he can't stay here. I can't, you know, I've had an asthma attack last August. I can't drive to Missoula and I can't breathe.
Right.
You know, but for some of us that are very low income, I don't own a house. And so people think that I don't pay that tax, where my landlord will raise my rent because of it, and I don't have a problem with it. Like somebody said, if I have to drive to Missoula to take my kid because he fell off the porch and might have broken his arm, that's a long drive with a screaming kid.
Yeah, it is. It is.
But so, one of my other questions is about incoming revenue. You have a lot of, you know, mammography machine and a lot of the promos that we see every month in the newspaper. Does that generate enough income and people to come in? When you do that, does it make up for some of those costs of the tests?
Yeah. Yeah, it does. And what we're trying to do is get people to come into the facility and see that we have changed.
Yeah. Well,
That we're due.
Somebody says, oh, you did a promo in February, so I'm just going to kind of wait for that promo to come next
Understand.
February, but now they're not going to do that.
Yeah,
So,
I understand.
well, they're not going to do that. I can go to Missoula and get it billed to my insurance, or I can go to
Right.
my doctor
Yeah.
in
Well,
Missoula to do that.
yeah, and you can get it billed through your insurance here. We'll do that for you.
And
So.
just my last question is, I absolutely absolutely love Dr. McClellan.
Good.
Love him. I have driven back to Spokane to have my kids' ear, nose, throat doctor look at him. And I love that he's here.
Yeah.
And I've had a bunch of parents where you tell them, your kid has chronic ear infections, your kid has chronic sinuses, take him to Dr. McClellan. I tell everybody all the time, you can't hear right, take him to him. And they had no idea, even though, you know, you see a poster in front of Castles or you read something in the newspaper, they had no idea about him. And how vital he is for the kids in this community.
Everything's social media now, and I think that should be a big thing that you guys push is social media.
We're getting there. Yeah.
But just to get these hearing tests for adults, hearing tests for the kids, getting them to go to him, he's a wonderful physician.
Yeah. Dr. McClelland is an ear, nose, and throat specialist who worked in Spokane Valley ear, nose, and throat for many, many years. He moved to St. Regis, and he works 2 days a week at our facility. And his practice, he sees lots of people. He's very busy and loves what he's doing. And he's a great gentleman. A great gentleman. So. Thank you.
Thank you, Ron.
Yes.
I'm going to ask, does MCH have a formal business plan?
There is a business plan, but it needs to be redone.
Is it something that we, the voters, can take a look at? Or at least the governing board? John, has the governing board seen this business plan?
No, I'm not familiar with it. We're working on redoing a lot of that stuff. I mean, we've worked through our budget, and we've certainly seen the budget. The budget is about to be redone again, based on where we are today. But yeah, no, it's.
Our fiscal year starts July 1st, so we will be putting together a budget. This decision that the taxpayers are going to make has a pretty big impact on what we do with our budget. So on May 5th, we'll know a lot more about what our budget needs to look like. Could change things dramatically. So.
We have I'm sorry.
Yes, sir.
Yeah, getting back to my original question, you kind of glossed over the answer a little bit. There's 600 and there's another $530,000. So over $1 million, I guess, two of them. And you said 2 years. Would they will be paid off if you put money with it? But how much money is this 49 mil going to create?
It generates $498,000 a year.
Okay, so that's almost $1 million. So there's still some left over. And is the 600 and the 530, is that accruing interest yet?
Yes, it is.
Okay,
Well, the
so
600, the payments we are making on it have interest because it's a capital lease. The 560, we are paying about $2,000 a month in interest. It's a very low. I don't recall it.
My last question is, I've heard it several times today, is that there's a lack of caring about the hospital, that they don't trust the hospital. You know, if you go back a decade or so, this county was fractured, and half of those people left the hospital, would not use the hospital anymore, and some of them have probably come back, a lot of them haven't. And then you said you don't want to dwell on the past. I agree. We need to look to the future, but we have to learn from the past. And I think you have to teach the community what the problems were, and how come we got in this predicament. We got to know. I mean, everything's being glossed over. Like about the 2 cars. Who knows? And then we said another story about 600 some thousand in St. Regis, which was way off kilter. Yeah, well, yeah, that's what they asked too.
Probably got agents on it.
Oh, okay.
Yeah. See, there's a lot of misinformation. You need to get out here and tell people the truth. Be upfront with it all.
And if I knew the answer to those questions, I would be more than happy to answer them, but I've only been here 4 months. I don't know the answer to those questions.
I know you don't know the answer.
Okay.
But I'm going to go to the house on Carswell, and I'm offering you a vendor slips here that you can have some of your staff, not you, not mom, maybe a couple of board members, and then just regular people who've been to work in the hospital. Come out there, spend the day, have a booth set up, and be able to have people come up and talk to them. And I think you should do the same thing in St. Regis at the flea market, and the same thing in Elmerton at the railroad station. You have to be out in the community so these people can approach you. They're not going to come to the meeting. I've been to a few of the meetings in a dozen years. I've been to maybe 3. You know, everybody's their life is busy, but if there's a weekend, it might take 5 minutes to come up to the booth and ask us a couple of questions.
I planned on being at the car show anyway. I think I've already made a contribution to the.
Yes, but here's what I'm going to pay. I'm going to pay for your booth. It's free of charge, sweet package.
Okay.
Set up and field questions all day long.
It's already on my calendar, so.
Well, I mean, have other people have a couple of snakes and people that are around all the time. That's the only way you can build confidence. We need to have that. The hospital's a luxury. It's not a right to have it, but
like I said, I've been going to every meeting that I can find, trying to attend all of these meetings, trying to rebuild some of those relationships. I went to 8 meetings in 3 days last week. So I'm trying to attend as many of these kinds of things as I can so that people can ask me questions and can, try. And I'll go back and I'll try and figure out some of the history, but I really don't want to dwell on what happened yesterday because I don't want anything to do with it. I want to go from there forward. I really do.
People have questions like they have today, and they want to know what happened to this word. Why did this happen? And you've got to learn from your mistakes, otherwise you're going to lose. Thank you.
I wouldn't have made some of those mistakes.
I agree.
Okay. Thank you very much. Well done. Does anybody else have any questions? Yes, ma'am.
We have some representatives here from the foundation, and my question is, how does the foundation fit into this, and what are they actually doing for the hospital at this time?
Yeah, the foundation, they have events that they do upcoming. They do an annual golf tournament. They are planning an airport event. They're going to be helping us work with a fair booth out at the fair. Some of the things they purchased for us recently, I contributed some dollars myself because I went into one of our patient rooms and they had remodeled the room. And I looked down at the floor and it was that 1970 yellow stuff that was on the floor. And I said, I can't do this. So I gave the foundation some money. Somebody else, it was Sherry Spangler. They gave some money and we were able to replace the flooring in that room so that it made the rest of the room look better. I went to the foundation and I said, can each one of you or can we come up with some more money to do the rest of the rooms? They decided at that meeting, here's enough money to do the rest of the rooms on the long-term care side. So we're going to have new flooring in all of those rooms on the long-term care side. Now, a good problem to have, right now we're so full that we've got one room that we're working on, and I'm not sure that once we get that room finished, that we're going to have any rooms that we can actually, our long-term care is full for the first time in a very long time. We had 23 patients in the hospital at one time last week. We had to go over and steal a bed out of the assisted living facility because we didn't even have enough physical beds. We haven't had that many people in the hospital in a long time. So I think we're turning the corner. I really do. So hopefully, and additional things that the foundation is doing. get back to your question. We had a unit that dries the air that's part of our ventilation, heating and ventilation system. And it was causing us lots of problems with water getting into our system, our heating system. They purchased for $2,500, $2,800 that new piece of equipment for us. I have another thing that I'm going to be going to the next meeting, a blood gas analyzer. The one that we've got is very old, and we want to be as accurate as possible. It's that piece of equipment can be very important for, as you guys know, up in the nosebleed section up there. Yes. A blood gas machine can be very important, so we're going to be asking them to replace that. They come up with a substantial amount of money, and they very, very well support the hospital.
Well, I'd like to say one thing.
Sure.
When we say they, we are saying you. All of the money that the foundation comes up with is from you and our fundraisers. And Mitzi here, who is Ron's secretary, we have a new brochure on the foundation. And it spells out in the brochure the total amount over 10 years. And then it enumerates the things that we have done for the clinic and the hospital and the long-term care facility. And when you enter the hospital, when you enter the foyer of the hospital, you will see an easel. And you will see on that easel listing what you folks have contributed. So we're just merely a conduit. And I have never seen, and I think I can speak for Ellie and the rest of the members, Judy and Carol and many others who aren't here tonight, we have never seen a community this small be so generous in giving. And you know some of the events we've had. We had a Hawaiian night, we had a 1950s rock and roll thing, we had a Western, we have the Sons of Beaches from Montana, and you folks have been exceedingly generous. So you can learn all about that if you just go to the hospital, look in the lobby, and go see Mitzi if you'd like a new brochure. So thank you very much for what all of you have done. Thank you. God bless every one of you.
Okay. Thank you very much. I appreciate all of your questions. I hope I've been able to answer at least a few of them. If you would like to come and see me, I'm at the hospital most days. My door is open. Come and see me. Many of you have already. I welcome you anytime. Thank you.